After I had my first surgery, the doctor actually made my nose crooked, and it was very pugged and pushed up, and this part of my nose hung down a lot, especially when I smiled. So he went back in again and tried to correct all that, and it was still very crooked after that, and this part still hung a lot, and it was still very pushed up. My nose actually started collapsing on the inside, and it made it really difficult to breathe and to sleep, and I was tired all the time. So after my second surgery, I needed glasses, and I went to the eye doctor to get glasses, and they couldn't even fit glasses for my nose. The bridge of my nose was completely gone.
She's 6 months after surgery now, and how are you feeling?
I'm feeling great.
Nobody's making comments about your nose anymore?
Nope, not at all.
No pig nose, none of that?
Nothing like that.
When she first came to see me, she had what we call a saddle nose deformity, a pig nose where the tip was all the way up here, and she was pinched on the side and had a hanging columella. So the short nose, saddle nose, and hanging columella are three very common deformities that I see in my practice in revision rhinoplasty. So I corrected it using rib cartilage as well as temporalis fascia. I also built her tip using multiple grafts, batten grafts, tip grafts, and I lengthened her tip, which was one of the most difficult things to do in a revision rhinoplasty. And I really released her whole tip and then used very strong pieces of rib cartilage to lengthen the tip of her nose to make it very soft, natural, and I corrected her hanging columella. So when I look at Melissa's profile right now, it matches her chin, her eyes, her forehead, and it looks natural. It looks like this is the nose that she could have been born with. This is the nose she wanted after her initial rhinoplasty. It's a nice straight profile, and it does not look pinched. It looks nice and round at the tip, and she has nice brow tip lines. And when you look at Melissa now, the nose is not bringing attention to itself. So when somebody looks at her, they're looking at her eyes, her other very attractive facial features. They're not focusing on the nose. The nose should not be the focus point of the face. It should basically contribute to the overall beauty and not bring attention to itself. The problem is that a bad nose job brings attention into itself, so the person is not able to focus on the remaining aspects of her facial beauty.
I feel that Dr. Rizk honestly gave me a better nose than I ever expected. He lived up to all the expectations I had for him and beyond that.